Today we are going to learn about the subclavian artery. The arteries of the neck, which consist of the carotid system and subclavian arteries. The carotid system, which include the common carotid artery, internal and external carotid arteries. We are going to learn about the subclavian arteries. Both right and left subclavian arteries which carry blood to the upper limbs. The territorial supply of the subclavian artery which extends as far as forebrain, the abdominal wall and up to the finger. Origins of the right subclavian artery. The right subclavian artery which arises from the brachiocephalic trunk, and it is developed from three sources: the right fourth aortic arch, a part of right dorsal aorta, and right seventh intersegmental artery. In this diagram we can see that the subclavian artery which arises from the arch of aorta, then which arises from the three sources. They are the right fourth aortic arch and the part of right dorsal aorta and the right seventh intersegmental arteries. In this diagram we can clearly see that the right subclavian artery which arises from three sources. The blue colored one, it is the right fourth aortic arch, and the red colored part which is the right dorsal aortic part, and the orange colored portion is a right seventh intersegmental part of the subclavian artery, the right subclavian artery. The left subclavian artery arises from the arch of aorta. Therefore, it possesses the thoracic part in addition to the cervical part. The left subclavian which is developed from left seventh intercostal artery. Next, the course of subclavian artery. The cervical part of each subclavian artery undergoes a curved course with an upward convexity and which extends from the sternoclavicular joint to the outer border of first rib, where it enters through the apex of axilla, and it is continued as the axillary artery. Each artery arches over the cervical pleura and the apex of lungs, and these arteries which subdivided into three parts by a muscle which is from the neck region, which is called as scalenus anterior muscle. The first part of the subclavian artery which extends up to the medial border of scalenus anterior muscle. The second part behind the scalenus anterior muscle, and third part from the lateral border of the scalenus anterior muscle to the outer border of first rib. Relations of first part of subclavian artery. Anteriorly, which is related with carotid sheath and its contents. They are the common carotid artery, vagus nerve, and internal jugular vein, and three muscles which is associated with there in the anterior part: the sternothyroid, sternohyoid, and the sternocleidomastoid muscles. Posteriorly, the first part related with the suprapleural membrane, cervical pleura, and apex of the lungs. Next, the relations of the second part of subclavian artery. Anteriorly, it is related with scalenus anterior muscle, right phrenic nerve, deep to the prevertebral fascia and the sternocleidomastoid muscles. Posteriorly, the second part of subclavian artery, which is related with suprapleural membrane, cervical pleura and the apex of lungs. And superiorly, it is related with the upper and middle trunks of the brachial plexus. The third part of subclavian artery, it is anteriorly related with middle one third of clavicle, the posterior border of sternocleidomastoid muscle, and posteriorly it is related with scalenus medius muscle, lower trunk of brachial plexus, suprapleural membrane, cervical pleura and apex of lungs. Superiorly, it is related with upper and middle trunks of brachial plexus. Inferiorly, it is related with the first rib. Next, the branches of subclavian artery. From the first part of subclavian artery, which gives rise 4 branches. They are the vertebral artery, internal thoracic artery, thyrocervical trunk and costocervical trunk. The thyrocervical trunk, which is again divides into 3 branches. They are the inferior thyroid artery, suprascapular artery and transverse cervical arteries. The costocervical trunk also divides into 2 branches. They are the superior intercostal artery and deep cervical arteries. This artery comes from the second part on the right side of subclavian artery. The dorsal scapular artery, which is occasionally arises from the third part of subclavian artery. Now we are going to learn some details about the branches of subclavian artery. First one is the vertebral artery. It arises from the upper surface of first part of subclavian artery. The artery passes upwards through the foramina transitoria of upper 6 cervical vertebrae. It winds backwards around the lateral mass of atlas vertebra and enters the cranial cavity through the foramen magnum. And at the lower border of pons, it unites with its similar artery of the opposite side to form the basilar artery. Therefore, each vertebral artery, which is subdivided into 4 parts. The first part or the cervical part, second part or the vertebral part, third part or suboccipital part and the fourth part or intracranial parts. Next, the internal thoracic artery. The internal thoracic artery, which is otherwise called as mammary artery, which arises from the inferior surface of first part of the subclavian artery, opposite to the origin of thyrocervical trunk and about 2 cm above the sternal end of clavicle. The artery runs downwards and medially in front of the cervical pleura. The artery enters the thorax by passing behind the first costal cartilage. It runs till the sixth intercostal space where it ends by dividing into superior epigastric and musculophrenic arteries. Next, the thyrocervical trunk. It arises from the upper surface of first part of the subclavian artery, just distal to the origin of vertebral artery. The arterial trunk divides almost at once into three branches. They are the inferior thyroid, suprascapular, and transverse cervical or superficial cervical artery. The inferior thyroid artery ascends in front of the medial border of scalenus anterior and then arches medially at the level of C7 vertebra between the vertebral vessels and carotid sheath. And the ascending branch of inferior thyroid artery anastomoses with the superior thyroid artery and supplies to the parathyroid gland also. The branches of inferior thyroid artery are ascending cervical artery and inferior laryngeal artery. The ascending cervical artery ascends on the transverse process of cervical vertebrae along the medial side of phrenic nerve and supplies the vertebrae and the spinal cord. Inferior laryngeal artery accompanies the recurrent laryngeal nerve and supplies to the laryngeal muscles and the mucous membrane below the vocal fold. The suprascapular artery runs laterally and downwards and crosses the scalenus anterior and phrenic nerve. It lies behind the internal jugular vein and the sternocleidomastoid muscle. It then crosses the trunks of brachial plexus and runs in the posterior triangle and behind and parallel to the clavicle to reach the superior border of scapula. The superficial cervical artery or the transverse cervical artery, it passes laterally and upwards in front of the phrenic nerve, scalenus anterior, and it appears in the posterior triangle in front of the trunks of brachial plexus and levator scapulae muscle. The artery ascends behind the trapezius muscle and anastomoses with the superficial division of the descending branch of occipital artery. Next, the costocervical trunk. It arises from the back of first part of the subclavian artery on the left side or the second part of the same artery on the right side. The artery arches backwards above the cervical pleura and on reaching the neck of first rib. Then it is divides into deep cervical and superior intercostal arteries. The superior intercostal artery descends in front of the neck of first rib and divides into first and second posterior intercostal arteries. The deep cervical artery passes backwards above the C8 nerve between the neck of first rib and transverse process of C7 vertebra. It then ascends between the semispinalis capitis and semispinalis cervicis and anastomoses with the deep division of descending branch of occipital artery. Some clinical importance of subclavian artery. First one, the cervical rib. It may compress the subclavian artery and diminish the radial pulse. Next one is dysphagia lusoria. The right subclavian artery may arises from the descending thoracic aorta. In this case, the subclavian artery that passes posterior to the esophagus and that compress the esophagus that may causes dysphagia lusoria. An aneurysm may forms in the third part of the subclavian artery that may produce pressure on the brachial plexus that may causes pain, weakness and numbness in the upper limb. When an obstruction to the subclavian artery proximal to the origin of vertebral artery that may lead to stealing of blood from the brain through the opposite vertebral artery. This may provide necessary blood to the affected side. The nervous symptoms incurred are called as the subclavian steal syndrome.